Okay, this is part two. My apologies for the interruption there. So I'm going to start over with this. I'm going to continue with this, the last essential that I was talking about was clinical prevention and population health. So we're going to look at systems-based practice, patient-centered care, and also essential 8, which is professionalism. So the way that I'm going to evaluate you in this course, you have 4 assignments here. The first is the student health improvement plan, so I'm going to show you that, and then health promotion paper, healthy people paper, and then discussion board assignments. So I'm going to move down here and describe the assignments to you, and I'm going to show you some links that I put on the Moodle course for you to navigate through these. So the first one is your student health improvement plan and action plan. So there's a couple of parts to this. The first one is you're going to create a SMART action plan. That'll happen the week of May 22nd. Then for 5 weeks after, you're going to work on doing a weekly description of how you're progressing on that, and I'm going to show you the form for that. And then at the end of this process, you're going to write a 3 to 5 page paper that'll be due on 7/17 that's going to look at your evaluation of your process. So when you look at this grading rubric, there are 2 parts to this. So the first part is the overview of the health improvement plan. And then this is a final summary report. So the first part of the health improvement plan is the identification of your SMART format, your SMART action plan. So let me just take you to the folder on Moodle that shows you that. So here we are, May 22nd, and right down here is this folder under lecture that says Personal Health Improvement Plan Form. So I'm going to open this up, and you're going to see there's a Personal Health Improvement Plan step-by-step instructions. There's a SMART action plan, and then here's the weekly action plan. So if you look at the SMART action plan form, this is what you're going to be filling out the week of May 22nd. Additionally, you're going to give me a nursing diagnosis on yourself that goes along with this. So you can type this up on a Word document. You can use this form to work on and save it as a PDF. But just remember that you're also going to include a nursing diagnosis on yourself related to your SMART Personal Health Action Plan. So I'm going to click open the step-by-step document. Actually, I have it open right here. So you're going to look at one specific health area you want to improve on. So one of the things that would be great to think about is something very simple. So maybe you want to eat 1 piece of fruit a day because you haven't been eating enough fruits and vegetables, or maybe you want to walk twice a week, or maybe you want to get more sleep, more rest, something simple. It doesn't have to be major. I want you to understand how we need to work with our patients to improve their healthy behaviors, recognizing that it's one small baby step at a time, and then that becomes routine and a part of our everyday practice, and it's a much easier way of doing things than trying to change everything all at once. So you're going to fill out that SMART Personal Action Plan. I'm going to go back to the course, and I'm going to show you some sample action plans. There's a link right here, SMART Action Plans. So for example, here's one, eat more fruit and vegetables. Let's see. So you can see you're going to list an area you want to see improvement on. You're going to write the SMART goal, and this is how you do it right here, SMART, measurable, action-oriented, reasonable, and time-based. And this is a sample of it. And the other thing that's really important about this is, you know, you want to think about, and let me go back to the SMART action plan form, what you're going to do for a reward for yourself at the end of this process. So let me pull up the blank form. I'll just go back to the holder. So down here, you know, one of the things that you should do is talk about, you know, what it is you're going to do in terms of giving you, you know, yourself a reward. So reward yourself when you reach your goal. Maybe you might want to treat yourself to something special. And then next week, the week of May 29th, you're going to start working on the actual weekly action plan form, which is in this folder also. So my weekly action plan for the week of May 29th, I'm going to go to bed every night at 9 o'clock. And then you're going to answer these questions, and every day of the week, you're going to see if it worked. You did it, yes, no, what worked, what didn't. Write any notes down here that you want to, and I'll have an assignment Dropbox, and on Sunday nights, you're going to upload that. So SMART action plan, and then starting the week of May 29th for 5 weeks, you're going to do those weekly action plans. And then at the end, you're going to write a paper on that. Now, in order to assess your health, one of the things that I would like you to do is to go to this link that I've provided you, ANA Healthy Nurse. This will give you some ideas for your own action plan. I actually have it open here. So when you click on this, you're going to see Healthy Nurse, Healthy Nation Grand Challenge. And I'm going to scroll down here. And so what is it? So I'd like you to read through this and see why the American Nurses Association is doing, and then how it works. So you're going to register to join this. And the way that you do that is you go here and you click on individual button, the individuals, and you're going to take the health assessment survey, and you're going to get a heat map of your own health risks. And it only takes about 10 minutes to do the survey. And that might give you an idea of something that you should be working on to improve your health. You're going to pick your focus area, you're going to make a health commitment, and you're going to participate in the health challenge by doing the SMART action plan with me and your weekly action plans. So you join the challenge down here, and these are some of the reasons why. There are lots of nurses that are doing this. There are different partners that are involved in this process. So this is really a new program that the American Nurses Association has launched. All right, so that's the SMART action plan. The next assignment, the next 2 assignments that you have are down here. And you're going to choose a health topic or issue from the textbook. This is your first paper called the Health Promotion Paper that's due 6/11 at midnight. I opened your course in case you guys wanted to get a jump on this ahead of time. And here's what needs to be included in this paper, okay? So the actual rubric for this is on Moodle, and I'll show that to you. But these are the things that you need to include in this paper. You're going to write a 4 to 6 page paper about a health topic in relation to your learning about health promotion and health prevention. So you're going to pick something, like I said, a health topic from the textbook or the ANA Healthy Nurse, Healthy Nation, because there are a lot of good topics there. You know, sleep, eating healthy, safety, workplace violence. Those are some of the different topics that are listed there. You're going to talk about the background, the statement of the problem. You're going to include statistics. You're going to provide examples of programs and interventions and national strategies that are being used to improve the health of this population. You're going to look at evidence-based recommendations. You should have at least 3 references for this paper. Right here it says cite at least 3 peer-reviewed journal articles or reputable websites for it. You're also going to describe your nursing opinion and insight about the issue. So this paper is worth 25%. It's due at 6/11 at midnight. The second paper that you're going to be working on is a paper called Healthy People paper, which is due by 6/25 at midnight. And you're going to select a health problem indicator out of Healthy People 2020 or Healthy Vermonters 2020. And you're going to write a paper on the health problem of your choice that relates to either adults or children. And so this is the rubric, okay? So you're going to read through this, and again, I would encourage you to take this right here and use it as an outline for your paper. You're going to do a description of the problem population, the epidemiology, the underlying causes, goals to improve it, describe the primary, secondary, and tertiary level of prevention. You're going to look at health education and teaching plans that need to be done. What are some of the barriers to improving the health problem? Cultural, spiritual, ethical, and financial issues. You're going to look at alternative tools, maybe some alternative therapies, some stress management ways to manage the problem. And then describe the global implications. What are some of the global implications related to this problem? Okay, so those are the two papers, and then you have your discussion boards. And it's Thursday night that the initial discussion board is due at. So that is your syllabus for the course. Yep, I'm going to cancel that. Let me just, yep. All right, so we've talked about what you need to do here in the top block. This is where your assignments are. And again, I'm just going to go back to the course documents. The health promotion paper rubric right here. I'm going to open that up. And if you just follow this rubric that's provided, if you use this out as an outline for your paper, you can see how it's going to be graded. So that's the rubric for the health promotion paper. And this is the rubric for the healthy people paper. And I know it can be confusing, so you've got two papers you're going to be working on. And this is the rubric here. So again, if you look here what the criteria is, if you follow this, if you use this as an outline, you'll do just fine on the paper. Okay, you will find that every week it'll be laid out like this, what your assignment is. Your assignment uploads will be here right under this block for, your smart action plans and your weekly plans, and any papers that might be due that week. I'll provide you with videos and resources. These will help. Healthy People 2030 is now out, so even though I've got Healthy People 2020 listed, you'll find it's now updated to Healthy People 2030. This is another link, Healthy Vermonters, to help you with your papers. And TED Talks, I always try to post some interesting videos for you to look at. And I always try to open the discussion board so that you can look ahead, so you can be formulating this. So even though you just have block 1 open, I try to have the next block open pretty much by the middle of the week that you're in. So you'll be able to look ahead. And I'm really looking forward to working with you, and I hope this video is helpful. Sorry to be a little long-winded, but I want to make sure that you get the information that you need, and I will be looking forward to reading your work. Okay, take care.